Right, hello everyone. I'm presenting today on a very specific case study of translating a multi-year large N research study into strategic communications programming in the context of Indonesia. It's a piece that I wrote with two of my colleagues, Morris Hamonaghan and Farah Putri, so presenting on multiple folks' work, not just my own. I'm an advisor to an organization called Frankie, which is an Asia-Pacific-based social impact communications agency. It does a lot of PCVE and Stratcom's work trying to shape more peaceful, equitable, and empathetic societies. Since 2018, we are working in Indonesia on a program called Harmony, which was one of USAID's largest PCVE projects globally, and inside of that, we provided the research and strategic communications support. I'll talk more about what that meant in a moment, but it's worth flagging that this research took place under a much larger project framework. We decided to try and approach the question of resilience and violent extremism through a validated framework. So we took the BRAVE, Building Resilience Against Violent Extremism framework from Michelle Grossman and a group of colleagues out of Deakin, and tried to transform that into a contextually relevant set of measures for the Indonesian context. That means that we took an existing tool and adapted it into several new categories that hadn't been examined before. We looked at 6 primary components: social identity and belonging across religious identity, national identity, and cultural identity; social cohesion, which is to say bridging capital, that's linking your group with groups that are not like yours; and linking capital, what's linking your group with authority figures from law enforcement to national levels to local levels; violence-related beliefs and behaviors; and then a kind of new addition, looking at misogynistic-related gender norms and support for gender-based violence, which comes on the back of considerable research showing the links between misogynistic norms and support for violent extremism globally and in Indonesia; mental health and well-being; and then look at media habits, which was linked more to our Stratcom's work, but also had some other ties to the rest of our research. So what did we do? We went to field, we adapted the study locally, we translated it, we designed a research framework that built on a sample of interviews with 1,210 survey respondents in Bandung, Indonesia. Why did we focus on this one city? Well, there were 4 universities that kind of took our sample of university students across different fields, so looking at STEM versus social science focused universities, elite universities versus more accessible public schools and religious focused institutions, and gave us a really interesting comparable study that we could control for various variables of student type, study type, and audience demographics. So we went and we interviewed 1,200 students. Then we decided to break this into different segments: those who were highly resilient, those who were less resilient, and those who were kind of in our mid-range. And we went and interviewed folks and had in-depth conversations with a further 24 students from these different groups, and then focus groups about 60 further. So this fieldwork took us a while. COVID happened in the middle, which, as we're reminded, is still a thing. So this took us a bit of time. This was 2021 that we started the study. We didn't finish our fieldwork till mid-2022 because of COVID delays. Then we went and kind of asked university officials and PCVE folks we work with what they thought of our results, and we kind of tried to transform that. It's a very long piece of research that I'm happy to go a lot more in depth into, but we're very short for time today, and we're going to talk about the implications. So let me skip to the conclusions. I'm happy to go much more in depth on the specifics of the study if you want, but the TLDR version, which is an acronym some of you know and some of you don't. Number 1, trust in government institutions was the most significant correlate to overall resilience of violent extremism in our study. We didn't necessarily expect to see that come out. We were slightly surprised at this. There's kind of some more nuance behind this finding. Specifically, trust in local officials mattered the most. Trust in national officials mattered a little bit less. We saw overall trust in law enforcement was lower, whereas trust in local government was higher. This varied across different ethnic groups and people from different backgrounds attending universities. Lots of interesting things to dive into there. Number two, diverse social networks and strong cultural identities also contribute very substantially to overall resilience, at least in the context that we were looking at in Indonesia. The feeling that you have a strong sense of cultural background, that you know where you come from, you feel that you have safety in expressing your identity also mattered. Critically here, the willingness to challenge the violent behaviors of others, especially in public but also in private settings, generally boosts resilience against overall entreaties of violent extremism and violent extremist ideologies. Those who adhere to norms justifying violence, generally speaking, if you think violence makes you stronger, if you think violence depicts you as someone who has more social standing in your society, you're generally a bit less resilient to violent extremism, at least in this setting. Continuing several previous studies on this subject, supporting violence against women strongly correlates with less resilience as well. So too, and slightly controversially, childhood exposure to violence, including domestic violence and bullying, does have a slight but significant effect on reducing overall resilience as well. This is a little bit of a tricky finding for us that we parsed out more in our interviews. Childhood exposure to violence should not be taken as any sort of predictor or any sort of risk factor whatsoever. It does appear to, however, have a slight effect over long-term resilience impacts within certain communities. This last one, I think, deserves a couple massive caveats around. There's been some very unfortunate discussions in the last while linking mental health to violent extremism. That is a deeply flawed approach. Increased resilience applies across a number of different exogenous social and societal shocks, right? If you're resilient against things, you're likely to be resilient against a whole number of things in your broader life. Resilience against violent extremism is not just a one-factor issue. So when I say that poor mental health and maladaptive coping mechanisms undermine resilience against violent extremism, the presence of mental health or well-being challenges that folks may be encountering doesn't mean that you're going to become a violent extremist. It means you're exhibiting other struggles in life that are worth bolstering your resilience against in general. Okay, so we had some conclusions out of this. And what did we do with that, right? So we actually asked useful questions for our programs team and for our community partners. And then we tried to design specific strategic community interventions on the basis of our findings. So, step one, we identify root factors, right? We look at locally relevant resilience factors against violent extremism, points where an intervention can actually boost resilience. We can have a positive intervention, not a negative one. Then we try to employ the right channels, right? Let's find, like Frankie and Joe were mentioning, the right messengers, folks who have local credibility, who are ingrained in local communities that are doing good work already, and then equip those groups with better skills to engage and create strategic communications campaigns. What do we do to actually equip messengers with the right communications tools? And then empower for greater interventions, especially in a contested online space. So what does that look like? In this case, directly out of the BRAVE study, we came up with 3 potential community groups that were interested in working with us. We worked with the largest women's coalition in Indonesia to come up with a set of anti-violent extremism campaigns. Several members had difficulty with being approached by recruiters before, and were also facing a context of increased gender-based violence in their communities. So we worked with 60 female leaders across the country to train around 500 members to design their own campaigns in community-centered contexts. Those were split between counter-violent extremism-based communications campaigns within their membership, as well as counter and preventing gender-based violence campaigns in their broader communities. So 2 different kind of target audience groups inside of that. We worked with one of the largest radio stations who also has a large online presence to design youth podcast competitions. So we were doing both podcast training boot camps. How do you design effective podcast messages? How do you work on questions of inclusion, diversity, tolerance inside of society? Again, this is coming to that second finding, right? Boosting those cross-cultural, sensitive cultural identity, as well as a diverse social network. And so we designed and created podcast series that then were run within university communities and individuals' communities. Then we worked on a mental health and gender identity strengthening campaign with the largest, most influential youth media organization. So we tried to create ideas of how do you work with female leaders and influencers to actually discuss mental health and well-being in relatable terms, and then actually go out and reach all of your audiences with this. So in total, those ran for about another 6 months out of that. So again, that's kind of a short snapshot of one piece of research with several interventions that were designed on the back of that. But those projects fit into a 5 years strategic communications and preventing violent extremism strategy. So in a larger programmatic framework, that means we continually designed bespoke research, training, and monitoring support that was linked with the needs of our broader programs teams and our local partners to then provide very specific evidence and very specific programmatic interventions that could be used and taken to field. So out of that, in 5 years, we put together 7 exploratory studies from BRAVE, as well as 2 of the largest studies of intolerance and violent extremism in the country, continual social media monitoring and trends monitoring that went directly into our partners' hands. We did training roughly every 6 weeks with our partners based on what they wanted to learn. So if you wanted to learn using short form video, if you wanted to look at designing podcasts or audio interventions, if you wanted to look at how to design offline communications groups, what were the skills that our partners needed? We'd find the right trainers, bring them in, and immediately deploy trainings to do so. Long-term mentorship matters, right? Short-term interventions tend to not do so well. In the end, I think we had something like 4.8 million people that we ended up reaching through our work, and about 2,000 pieces of interesting creative content and campaigns that ended up getting deployed. So what did we learn across that? Some really great overlaps in this last piece that I think are generalizable beyond the specific context of this project. Number one, that strategic communications needs to be institutionalized in long-term programming. One-off Stratcoms pieces tend to flounder, and they have been rightly criticized on a number of levels, including by a few folks in the room. Designing strategic communications strategies need to be aligned with other teams, need to be aligned with donors, aligned with local partners, and you need to have a culture of experimentation and learning. Figure out what works, what doesn't, iterate it, and try it again. 2, you need to listen really well, right? Figure out what people want to learn, then get answers for them. When we designed this one research piece, we spent about 6 months in scoping, figuring out what our partners needed in terms of evidence, then ask questions that were directly relevant, right? If you're designing research, don't just ask things that are only relevant to me as random white Galen researcher. Ask what people actually want to learn, then go and get answers. So normalize evidence, disseminate those insights regularly and frequently. 3, as we just heard, we're generally not the best messengers. If we're in PCVE or CT technical work, we're usually a bunch of policy wonks. We usually lack credibility with our target audiences. We should work alongside local partners to figure out what people need for their own communities. That might be innovative and online. It might use generative AI, or it might not be at all. It might be an old school, offline, one-to-one, peer-based mentorship intervention that uses radio ads and that uses small flyers in schools, right? It might be peer-based interventions where you're having long discussions inside of individual seminar groups instead. Things vary enormously. 4th, we don't just need to put out narratives, right? We need to convene and provide systematic mentorship and partnership that creates an ecosystem that turns particularly youth and younger audiences into lifelong advocates and supporters. To develop peer mentorship networks, to develop one-to-one relationships matters for the long-term transformational type of work that we need in this space. That's about it. There's a lot more information in the actual research study. There's about a 45-minute talk I can do just on that, but I was told 12 minutes, so I'm slightly over that. QR code for the full report and presentations on it if you're interested. And if you want to chat more, please let me know. Thank you all so much.